Hi, I'm Michael Baldinger, and I'm Medical Director at Harborview Recovery Center. I first entered the field of chemical dependence in 1981, and Harborview is a culmination of a desire I've had for 30 years to set up a treatment program that could treat the physical consequences of addiction as well as the ongoing psychological, spiritual, and social needs of people who suffer with substance use disorders. Harborview is unique in that because we're in a full-service hospital setting, people who have a variety of medical needs, psychiatric needs, physical medicine needs can be accommodated. And while they're being treated for their substance use disorder, they can also get additional assistance, both medically and psychiatrically. We're lucky in that we have a team of nurses, therapists, milieu techs, and an administration in the hospital that understands and is sympathetic to the struggle that the recovering person is going through. It's our role in Harborview to set the stage for that ongoing rehabilitation. And that's what's exciting to us, and that's what motivates us. And that's what I see our role as in the patient's journey. We see people from all walks of life. The stereotype of who is an addict is really not applicable to the people that we see. We see people who are professionals, doctors, lawyers, people who are very successful in the areas of finance, to blue-collar workers. Some people are unemployed. We see people that span the spectrum of all walks of life. The assessment piece of Harborview is very critical because it's at that point that we have a prolonged interview with the patient and we determine what their specific needs are. After about an hour, hour and a half of discussion about the specifics of an individual's situation, we determine whether or not they need inpatient or outpatient care. It's not unusual that somebody just needs outpatient care and does not have to go through inpatient. Inpatient is generally reserved for people who have to be detoxified or have specific circumstances that make staying outside of a hospital setting unlikely to result in a successful episode of treatment. But after a very comprehensive intake assessment, we will make the appropriate recommendation for the level of care. Quite a few of our patients enter treatment in the outpatient mode of therapy that we offer at Harborview. We try and match treatment setting to the acuity or the severity of the illness. Some people are very appropriate to start an outpatient treatment. People who maybe are not as far along in their illness, who have greater stability in terms of their life and living situations, and we take a significant number of people directly into our outpatient program. Not only does the individual addict suffer with the results of their addiction, there's always a family in the picture. Everybody suffers. Everybody needs information, and everybody needs healing. Family involvement is a key component to what we do at Harborview. We involve families early in the process. We have specific programs oriented to answer the questions that families may have, and again, to care plan and develop a plan of action to help people as they go along in recovery to heal. This is something that doesn't happen right away. It's a process, but we are very, very focused on finding out what the problems are and setting plans in motion for an ongoing therapeutic approach to the situations that are existing in families at the time that people come into treatment.